everyone suffers from the occasional bout of heartburn, but when it becomes chronic, it is time to see your doctor. Left untreated, reflux disease or GERD can cause serious problems. November is GERD Awareness Month, and Gunderson General Surgeon Shanu Kothari joins us now to explain why GERD is so serious. Good morning, doctor. Thanks for getting up with us.
Good morning, Amy. Thanks for having me.
Can you explain what untreated GERD can lead to?
Yes, so untreated GERD, or gastroesophageal reflux disease, often develops the symptoms what we call heartburn. And left untreated, this can cause damage to the lining of the esophagus, and that can lead to inflammation, scarring, and on rare occasions, precancerous changes.
So this is not something you should just think of, I'm going to pop an antacid and let it go.
Well, for majority of Americans, that's fine treatment, but for some patients that have chronic disabling treatment where they are on medicine every day or their medicines aren't working, they need to at least consider a surgical alternative.
And there's a relatively new procedure called the LINX procedure. Can you explain what that is?
Yes, the LINX device, actually I'm holding one right here. It is a ring of magnetic beads that is surgically implanted in a minimally invasive fashion around the base of the esophagus. The reason patients have heartburn is because the valve between the esophagus and the stomach is not working properly. So the acid is allowed to splash up where it doesn't belong and cause the symptoms. This ring of magnets is implanted around that valve to strengthen that valve to make it less likely for the acid to splash up to cause those symptoms. You
know, anything when you hear the word implanted doesn't sound minimally invasive. Can you explain why this procedure fits that definition?
Yes. It is placed laparoscopically, so small incisions are made in the abdominal wall, and what we call laparoscopic surgery or minimally invasive surgery through 4 small incisions, we can place the device around the esophagus, and patients are able to often go home the same day.
Really? It's an outpatient procedure. And then what's total recovery time like?
Most patients are back to work in a few days, and what's unique about this device as opposed to some of the other more traditional surgical procedures that is offered for heartburn is that patients can go to eating solid foods right away.
Wow, and how long does that ring last?
Well, it is, they've got their titanium beads with a magnetic core, so theoretically for the lifetime of the patient. We were part of the original trial in the country that only had 14 centers, and we implanted 8 of those patients out of the 100 in the original first U.S. trial a few years ago, and we've had very good success with it. It is now FDA approved, and we are one of the few centers in the country that is offering it.
Wow, and it can be life-changing for the patients that it is successful in. Well, Dr. Kothari, thank you so much for joining us. Again, November is GERD Awareness Month. If you're struggling with chronic heartburn, it's probably time to speak with